should we? Mr. Jenrick, good of you to join us this morning. Thanks very much indeed. I'm sure you're very well aware of the Imperial College study suggesting that 100,000 people a day in England are being infected according to their figures. How on earth did we get here?
Well, look, we know that this is a very serious situation now. You can see across Europe governments having to take very difficult decisions. This is a moment in which we need to all continue to take responsibility, to follow the public health guidelines, the most simple things being the most effective, like washing our hands, wearing a mask and staying socially distant. And we as a government will continue to take action in the places where the virus is most concentrated. You've seen overnight that we've reached an agreement with Nottingham and Nottinghamshire. And then over the course of today, I'll be working with local leaders in Leeds and West Yorkshire, another area where the virus is very concentrated, to see if we can reach an agreement there. We'll continue with our localised but proportionate approach of taking action where the virus is strongest. But you can see from those figures that the virus is in a bad place in all parts of the country. So this really is on all of us, irrespective of where we're living today.
That suggests that at least tier 3 in London and the south then, doesn't it?
Well, we haven't taken those decisions. We are taking action, as I say, in the places where the evidence very clearly shows that the virus is strongest. That is predominantly today in the Midlands and the North. But if it's required in other places, then obviously we'll follow the science and do the same. The approach of trying to bear down on it where it is most concentrated, I think, continues to be the best way forward, because despite the fact that the virus is rising across the country, it is very concentrated in some places nonetheless. And so that's the way forward that we will continue to follow.
Yeah, but that report is suggesting that potentially we're heading towards an R rate of 3 in London and the southeast. We need to do something now, don't we?
Well, we are doing something now in many of the places that you just described, like London. We took measures over a week ago when London moved into tier 2. That did mean further restrictions, which were difficult at the time, but now seem to be the right decision. And that is helping to reduce the amount of social contact, reducing the spread of the virus in London. If we need to take further steps, then we will do, but we're keeping that under close review. We don't want to create a second national lockdown. We know that that has some effect on bearing down on the virus, but we also know that it's immensely destructive in other regards to people's lives and livelihoods and to broader health and well-being. So we will do everything that we can to avoid that situation by focusing on the places where action definitely is required. And you can see that we're doing that every day with the discussions we're having with local leaders.
The longer the wait of moving into tier 3 across the country, or indeed a circuit breaker, the more deaths there will be. Who will be responsible for that?
Well, there is harm in either approach. If you take a blanket national approach, that has some advantages. You can see some European countries moving in that direction, but you can also see how immensely destructive that is in other respects. You can see the harm to people's lives and livelihoods, which will have long-term scarring effects upon them and their families. You can see the damage to mental health, the cases that get delayed beyond COVID elsewhere in the NHS. And so the role of the government has to be to balance up those two factors and take a judgment about what is right in the best interest of the country. A circuit break would not be a short-term measure. It looks like France is approaching it as a 4-week circuit break at least. And so that is a very serious step, and one that we want to try to avoid if we can. It is right that in the places where the virus is most concentrated that we take further action. And I think those talks with local leaders do need to be speeded up so that we reach amicable and constructive solutions quickly in those places. Sometimes it's taken a number of days. We now want to move faster in those places so we can put in place the measures that are needed in places like Nottingham and Nottinghamshire. And as I say, we're moving into discussions with a number of other parts of the country as well.
The Chief Medical Officer and the Chief Scientific Advisor are pushing hard, we believe, for a national circuit breaker. How regularly do you review that?
Well, the Prime Minister and ministers receive advice and have discussions with the Chief Medical Officer and his team on almost daily basis. That's certainly guiding the work that I'm doing in terms of taking forward local restrictions. It was on the advice of the Chief Medical Officer and the Joint Biosecurity Centre that we took further action in Nottingham and Nottinghamshire, and it will be if we take further action in other places to come. So, of course, we're informed by our scientific advice, and we're very grateful for them. But as I say, they themselves would acknowledge that the role of government is to balance that up with the broader harms that come with a full, long national lockdown. And we will do everything we can to avoid that, but obviously we'll keep all the options under review, as you would expect us to.
So you're reviewing a national circuit breaker on a daily basis?
No, I didn't say that. I said that we take advice from our medical advisors on an almost daily basis, but the very clear policy of the government is to do everything we can to avoid a full national lockdown for all the reasons I've just described, that it can cause a whole range of harms, both economic and in terms of health and broader well-being to people across the country, and we don't think that's the right way forwards.
Yeah, and my question to you, sorry, Mr. Jenrick, is how often do you review a national circuit breaker?
Well, we are considering the options regularly, but as I say, at the moment, it is our very firm view that that is not the right approach for the country. It is not a short-term measure. It is likely to be for a number of weeks. If it succeeded, it is likely then needed to be repeated regularly. You can't have a stop-start country where businesses are closing, people are losing their jobs, then they're having to restart again. The harm to people's mental health and broader well-being, I think, would be immense. So we're not in favour of that approach. We have to do everything we can to make a success of the proportionate but localised action that we're taking. And as I say, that is now escalating as we're taking further talks forwards with other parts of the country. Leeds, West Yorkshire is the next area that I'm in detailed conversations with local leaders on.
Yeah, but I mean, the reason I'm pressing you on this, Mr. Jenrick, is because they are doing that in Wales, they are doing that in Ireland, they are doing that in France, they are doing that in Germany, and they are taking all of those matters into consideration as well. Why are they wrong and the Westminster government is right?
Well, these are difficult, balanced judgments. We don't deny that. And we can sometimes come to different conclusions than others, our friends in Europe or the devolved administrations. There are things that those governments are doing which we have done for a number of weeks and which have been points of debate and discussion in the UK. For example, having curfews and closing pubs and restaurants early. I've been on this programme before in which you have understandably pressed me on whether that made sense or not. Other countries are now following us in that regard. We are taking tougher action, you will see, in some of the localised approaches that we're taking. Now, in Nottingham and Nottinghamshire, the government, together with the local leaders, have chosen, for example, now to limit the sale of alcohol off sales, so from shops and off licences, after 9 p.m, so that those people who are no longer able to be in regulated environments can't go and simply purchase alcohol in the shops and then go and hang out in unregulated environments. So we're learning at every step as to what further steps we should be taking, but the government continues to take a balanced approach here, which we think is the right way of ensuring that we do bear down on the virus, difficult though that's proving to be, whilst not inflicting such devastating harm on our economy and our broader well-being.
Okay, I know that you have to dash, so another couple of quick points, if I may. Police saying that they will break up family gatherings at Christmas if they break the rules. Is that the right decision?
Well, the police have a duty and a responsibility to enforce the rules. We obviously want to ensure that families can gather for Christmas. I want to be with my own family at Christmas. That's some way off. What we have to do now is take action, decisive action now against the virus to give us the best possible chance of being able to achieve that. And that's exactly what we're trying to do.
Okay, so yes, they would be right to break up family gatherings if they didn't abide by whichever tier the family was in.
Well, I didn't exactly say that. I said that I'm not going to criticise the police for saying that they intend to abide by the law. That would be a pretty perverse thing for me to say on your programme. What I do want to have is families be able to gather again at Christmas. I think that's extremely important. I would love to do so with my own family. But the way to get there is for us all to abide by the basic rules today and for the work of the government and local leaders to progress swiftly so that in those places where the virus is concentrated, we take decisive action now and give the country the best possible chance of being in a good position for Christmas.
OK, so the police have to do what the police have to do. More than 1 million people have signed the Marcus Rashford petition for free school meals for kids when they're not at school. Is there any point in me asking you whether you might change that for Christmas?
Well, we've said that we'll continue to keep that under review. We all share the same objective. Of course, we want to ensure that young people and children get the best possible life chances. That's at the absolute heart of the moral mission of this government and of the Conservative Party. We're doing that in a number of different ways. Recently, we gave £63 million to local councils so that they can help to support children and vulnerable people through the autumn. That money is coming towards the end of the period in which it was due to be spent. If we need to take further action, we will do. There's no dispute on what is our goal here. What is up for debate is the best way to achieve it. And there is a legitimate argument about whether it's through further advances in free school meals, whether it's through targeted support of the kind that we've been doing recently through local councils, or it's through the benefit system, where also we've been putting extra money. We put £9 billion, remember, additional funding into universal credit and further support for local housing allowance to give families on the lowest incomes in the country more money in their pockets as they try to weather a difficult year.
OK, as you know, that £63 million wasn't necessarily for feeding kids, and the Mayor of Liverpool said that they used most of it on PPE. But I must just ask you before you go.
Well, it was actually, just to be clear on that.
More about that, if you would.
Yeah, absolutely. Well, if you remember at the start of the pandemic, we launched our Everyone In programme. That helped to get over 90% of rough sleepers off the streets at the start of the pandemic and protected hundreds, if not thousands, of people's lives. That work hasn't stopped. We've now got 29,000 people in safe accommodation who were otherwise homeless before COVID. We're now launching a £150 million programme to buy over 3,000 units, homes, for these people so that we can get them into safe, long-term accommodation and get closer to our goal, which is to eliminate rough sleeping over the course of this Parliament and to put that pernicious social ill to bed once and for all.